Good afternoon. It's Monday, April 20th. I'm Gary Pace, Public Health Officer for Lake County, and this is the coronavirus update. We do this every couple days, and Priscilla Morales is doing a Spanish version on a different video that if you need the Spanish language one, you can get that. The current numbers are California cases are 31,000 cases with 1,200 deaths. We're seeing a decrease in the number of new cases, but the number of deaths is continuing to rise a little bit because of the lag time between the start of the infection and people getting really sick. Sonoma County has had a total of 180 cases. Lake County has had a total of 6 cases. All but 2 of them have recovered at this point. There were no new cases over the weekend. We are noting signs of community spread. There's 2 different pieces of data that make us think about this. One is we haven't really seen an increase in hospital visits or ER visits, so we're not seeing serious illness at this point. But we have noticed that when we did some investigations of some of the cases that we did identify, that there were some people that had been sick a couple weeks ago that have gotten better that may have been coronavirus cases. The other thing is that we did some testing of some of the sewage at the sewage treatment plants, and it did show signs of virus particles in the raw sewage before it got treated. So we had tested this a couple of weeks before, and there was no signs of any virus particles in it, and then the last test from April 8th was positive. So this is not infectious. It doesn't get in the water. There's no real concern for any kind of infection from the sewage for either the community or people working there, because it doesn't seem like it's alive, and people that are working at the site are wearing special equipment. But it does give us a sign that there's probably some infection out in the community that we're not picking up with our tests because we haven't been able to do enough testing, but it is showing up in the sewage. Community spread is an important thing to talk about a little bit here, because the goal of controlling the virus is not to stop any virus from getting into the community. Eventually, we're going to need to get what's called herd immunity, which means 75 to 80% of the people in the community have antibodies to it. So they either have gotten the infection or they've gotten the vaccine. Unfortunately, the vaccine isn't really available for a year or 2 now, probably. So most likely, most people are going to need to get exposed to the virus and get over it and then have immunity to it. So part of the strategy here is to have the virus enter the community at a slow rate and then move through the population in a controlled fashion, so that we don't get an overwhelming surge of people coming to the hospital, and that we're able to protect the elder people and the people with underlying medical conditions who are most vulnerable to severe illness. The ways that we're going to be able to control the spread of it through the community is with testing, contact tracing, and home isolation. So those are the tools that we have in our toolkit at Public Health, and we've talked about that a little bit in the past. Maybe I'll go into that a little more at our next video. But overall, we're doing pretty well, and it seems that people are sticking with the shelter-in-place orders, which I'm really pleased to see, and people tend to be wearing masks when they're out in the community. So if you have any questions, go to our webpage and from the Lake County Health Department, and look on there, or contact us through the email. We do have some new graphics on there that are really cool, so I encourage you to take a look at that. All right, thank you.